Oh, here I am. Okay, so you have heard all these wonderful facts from two very smart doctors. Now you can kind of maybe help me together. We can focus on the process rather. I would be talking about family planning, and that's applied to many different situations, and also maybe discuss briefly the importance of testing your partner for CF carrier status, and because there's a lot of people overestimate the risk of their offspring. So by discussing that, perhaps you can get a better idea and can more accurately estimate the risk if you decide to have children in the future. And then I'm going to briefly talk about when I meet with a couple or the women, it's very important to discuss, how to find helps and resources to make sure that when you're healthy, you have help. When you're ill, you have help. Should the unfortunate event happen, your children and your loved partner will also have help and continue on with life. And also how I would like to link patients to other couples who have gone through it, because we know the facts, but nothing like someone who had gone through it, especially couples that are going through assist reproductive technology. The woman partner has to get very much involved with the whole process. And perhaps at the end, we will talk about when is the real good time to get pregnant and how we finalize the referral from our clinic at least. So for me, family planning is really simple. Is my definition of family planning is really a sensible approach to have a family. And it can apply to, as I mentioned before, very different situations. The one first scenario would be that, I might like to have a child in the future, but I don't think at the current time I'm not physically or emotionally ready, or I am working on my career and my schooling, and I'm not quite ready for it. Then the most responsible way to approach family planning to make sure that there won't be any unplanned or unwanted pregnancy. To do that, it would mean using birth control. And in our program, most young women have used birth control pill very successfully, and is proven to be most common and most effective. And it doesn't really interact very much with the CF medication, including a lot of the antibiotic we use to treat chest infection. A few young ladies chose to use Depo-Provera, which is an injection with progesterone, which will prevent ovulation and thinning out the lining of the uterus and making it very difficult for a fertilized egg to implant. And it's only required you to get this injection every 12 weeks, so a lot of people prefer that. The only drawback in this particular option is that, as some of you might know, that CF patients seem to have a higher risk of developing bone thinning or osteopenia, osteoporosis, and this particular medication can potentially cause that happen as well. This is not the evening to talk about various ways to use birth control, but I have an excellent area that we have put in wonderful information of very different methods, from abstaining to diagram to condom to you name it. So you can go to our website, and there's a very rich section of information that you can read about. And our website is now on the screen, so you can write it down. For another thing, most important, while you're not having children yet, but you're still enjoying being sexually active, the most important thing is to practice safe sex. And obviously, ladies should expect the respect of asking the gentleman to use a condom. At least you can help prevent the unexpected sexually transmitted disease, and you don't want any additional organism that might affect the health of your reproductive organ when you're ready to have a child in the future. For most male with CF, the young man, there are enough studies from Australia, from the UK, and even from Sweden have mentioned that many young men actually prefer to have semen analysis done at an earlier age. And one study from Australia especially demonstrated that men learning about their infertility at later age has much stronger emotional impact to the information. So therefore, I believe that it would be probably good to from the pediatric center almost when patients transition to us that we can offer this particular service, because that's also at the same time you can clarify some issue. Earlier you heard from Dr. Javi that these young men have normal sexual desire and performance, and you don't want young men to confuse infertility as impotence. That would be kind of a sad thing. So so now the next stage would be, now you think you're going to have a baby in the near future. So if you're a woman living with CF, you might want to first find out more information about how to have a successful planned pregnancy with successful outcome and best outcome possible. And one of the very beginning step would be to introduce your partner to the clinic and ask him to do a CF carrier testing. And again, this will help you understand a little bit more the risk of your offspring should your partner is a carrier or not. And we'll talk a little bit more in detail in the next couple of slides. And then maybe also talk about choosing a most appropriate time to start a family, meaning when you're emotionally, physically, and financially available and ready for it. That would be the best. And listen to the doctors or nurse practitioner who works with the clinic and knows about this topic very well, and find out options such as how to plan a successful pregnancy, and although that's actually the most common method among our young ladies. And for those who don't want to carry it on your own, there will be other option of adoption or surrogacy. Surrogacy is, of course, having someone to help carry your own biological child. We have a couple of young women successfully with it, and the babies are absolutely beautiful, so that is also an option. And it may not be a bad option for a young woman who's at post-lung transplant stage. It may not, affect their health as well. So now that if you're a young man who found a wonderful partner, then you want to think about having a baby in the near future. What would you do? Well, I've talked to many young men, and some of the most difficulty actually is at the beginning. When do I inform my partner that I have CF, that I might have infertility, and I may not have the ability to father a child naturally, but I can father a child with some assistance or some good planning, or have a child with a different option. And it is no right way and when to tell. Many tell different stories at different period of time. The only advice is that you don't want to leave it for too long, and then most young ladies would find that a bit of a mistrust. But we have many different stories. So when I see each of you, maybe that we can talk about more, and I can refer you to another young man who have gone through it and able to share with you. Then again, once you found a serious partner, you think that will be your mate to have a wonderful baby, then you should ask this young lady to do a carrier testing the same way like the young woman. Then you want to find out the actual estimated risk for having a child that may become a child who is also living with CF. And these information sessions are equally you can have with your doctors or your nurse practitioner. I would advise that oftentimes it's better to book a separate time, because during a clinic visit we're also busy getting everyone through. We might not have time to talk all the detail and show you slides and all that and do more detailed discussion. And for our young men, in the last, I would say, 15 years, they're more interested in reproductive technology and having their own biological child. But some would choose the option. In fact, I remember earlier, before 1990, end of 1990s, and many young men have wonderful family by using the artificial insemination with donor sperm method, and they have lovely family with a couple of children as well. And so adoption is also another option. So these are stuff that we will talk about during our meetings. CF carrier testing is important in a way because you then also explore your feeling about if you should have this. You tend to land on being a higher risk if your partner should be a carrier, because I think it's important to explore those feelings before you venture into having your own children. And as you know, that 1 in 25 Caucasian will carry a CFTR mutation, so it is not that uncommon that you may run into a CF partner who also is a carrier of CF mutation. But rest be sure that when we test carrier testing, we're really only testing against 39 most common mutations. But with that testing, it would be enough to estimate the risk, because the other mutations are being found every day. I remember when I first started my job, there was only 400 mutations known to me at that time, but now we're looking at 1,700 and more mutations. So even if we test it all, by next year you might miss one or two. So it's not worth going through the entire panel that people would have very rare mutation that you may not even have. So once you test against that 39, most importantly to realize that it would put you in a very educated low or definite risk, but it is not 100% prove that you are not carrier. But I think that's probably good enough. 2% risk for infant who not having parent did not do carrier testing. But once you did the carrier testing, if your partner happened to be a non-carrier, the risk is now dropped to 1 in 500. So that's probably a lot of time actually comforting enough for a lot of young couple to start planning. But if the carrier happened to be if the partner happened to be a carrier, you're looking at a 50% chance. So I draw these two diagrams just to show you. At the start, you have to remember that you need one abnormal mutation from each parent. So you have to have two abnormal CF mutation. You have to have two CF mutation. To have CF. So in the scenario on the left, as you can see that if the square represents the male, does not carry any CF mutation, so he have normal mutation, normal CF1 gene, normal CF2 gene, then he marry a young woman or have decided to form a family with a young woman who has CF, which is represented by the dark yellow or orange color with the label of mutation A and mutation B. As you can see that you have to get one of each from each parent. If the father has nothing abnormal to give, it's almost impossible to have two mutations pair up to create someone with CF. So as you can see, all the children from this couple, for every pregnancy, chances are they would only be carriers. For instance, one normal A gene will couple with a normal one gene will couple with the abnormal A gene for mom, or one gene will couple with the abnormal B gene, and so on and so on. So it's not possible to have a child with CF. If you look at the right side of this picture, you can see that if the young man happened to be someone who's living with cystic fibrosis and have a partner who is also a carrier, meaning one normal gene and one CF mutation, now you can see that mother can also offer one abnormal gene, and there's a good chance that the C gene can couple with A. Together, mutation A and C will give a chance of cystic fibrosis, and or mutation B and C will also combine and have with creating a child who has cystic fibrosis. And so the chances is really 50-50 if your partner is a carrier and you are living with cystic fibrosis. So I think a lot of it most important before we talk about another slide is just to explore your feeling about it. The options can change if you happen to have a chance of having a child 50-50 to have CF. But that's okay with that. You have the information to plan. If you have a CF child, you might have to think about changing your tactic and maybe work less because your child would have more doctor's appointments, or you have to spend more time caring for that child. Now, when is the best time for a woman to become pregnant? Well, it's actually the best time is both you and your partner are ready for it. And then we will have to look into your health situation. Is your lung function being maximized at this time? Is there room to further improve your lung function? Although, there's no hard rules about what number. In the earlier study, they talk about 50%. But really, more important is you have a decent lung function that has been maximized, and take advantage of all the available treatment that's advanced treatment that is available to you to keep that lung function in a good position and remain stable for 6 months. I tell you, it's much easier to guide a pregnancy through if that young woman has stable lung function before they venture into the pregnancy. And then you think about the nutritional status. I once heard an OB doctor said that babies are parasites. They will survive. Don't worry. But they'll suck nutrient out of the mother the best way they know how to survive. So don't worry about the baby, but worry about the mother. So then you have to think about if your nutrition status is not decent with the body mass index of at least greater than 20, you might have a lot harder time to gain weight through that pregnancy. Also, during the first trimester, you might be a little bit nausea and you might end up losing a little bit more weight at the beginning. Then will make it very difficult to catch on later on. Another aspect is that we know that now when people are living longer, there's a greater chance of develop CF-related diabetes as an adult, and the percentage is as high as 40 to 50%. And so you want to make sure that you've done a oral glucose challenge test within the last 6 months. If not, ask the program to the team member to help you facilitate a test like that to make sure that we can follow you closely if you do have oral glucose intolerance or have diabetes. For those people that actually have CF-related diabetes, it is very important to make sure that your blood sugar is in good control with the hemoglobin A1C, which reflect how well you manage your sugar over the last 3 months period, to be at least less than 7%. Because study had shown that if you're going into a trying to conceive with a much higher than 7% hemoglobin A1C, you're exposing your child to neurotubal defect. Those are the cells that make the brain and the spinal cord later on. So you don't want your child to have impaired brain or spinal cord. That's a serious issue. So that's very important. Also, the latest guideline from the CDA guideline 2008 clearly stated that if you do not have CF and sexually active, you should stay on folic acid 1 milligram daily. If you have CF-related diabetes, then you should probably consider taking 5 or have diabetes alone, have to start taking 5 milligram of folic acid at least 3 months prior to your conception and stay on the same dose until you're at 12 weeks of gestation. Then you can go back to 1 milligram. And those are little things, but they're very important to assure the child's well development. Well, then how do you identify some resource before your pregnancy to make sure that the whole pregnancy is going to go through smoothly? Well, first of all, depends on where you live. You want to identify an obstetrician that is easy access to you. You can go visit him or her frequently if you need to, or during your regular visit schedule. And but most importantly, the obstetrician must be willing to work with us, the CF team, because we will be expecting to follow you. As you remember, Dr. Tullis mentioned before that, we follow you closely for your sugars, for your vitamin level, for your weight, for your lung function. We want to pay attention to your lung health. So if there's any sign of infection, we will be very aggressive. So that means frequent visit to the CF center, and it's actually monthly prefer. So obstetrician, we're very lucky at St. Mike. We have a very good group of obstetricians, and they would even go to the ward and visit our patient if you're not feeling well and follow you while you're being hospitalized for CF exacerbation. So, of course, if you live in Toronto, that's easy. But if you live far away from St. Michael's, you might want to find an obstetrician closer to you. As long as we can communicate, and that would be fine. Now, pregnancy does not affect survival, but you talk to any woman who have children, motherhood can sometimes really affect survival. And I think about, myself having children. I used to love hot food, and once I have children, while they were little, I couldn't enjoy any hot food because you're busy feeding your children first before you eat your own meal. So it is important to remember that even, when you're raising your child, motherhood can be against your health. So you must find the adequate support system, and for good planning, you can actually do that prior to you actually become pregnant or while you're being pregnant. And that those support systems are very important to check out, like maybe parents on both sides or just one side, um, or other supports like cousins, sisters, or friends. Long ago, I had one woman who told me that you prepare me for everything, but you didn't prepare me for my mother-in-law. Well, it's hard to say. I'm not saying bad things about mother-in-law. I only have sons, so I'll be a mother-in-law someday. But anyway, you want to identify people that are actually helpful and that really is not going to cause more stress to you. And you two as a couple must hang in together and find that person and clearly identify when this person can come so you can do your physio, you can take your mask, and when they can give you sort of a quick break in the end of the week so you can go to exercise or whatever. You do have to find out these supports, and should you become ill, who's going to step in and help you out. And if you want more detail, oftentimes it's easy. We have a large program, or even if you're not from our program, to find another woman that you can talk to by phone or via email so that they can share their wisdom with you. Now, regarding male, now you're now successful, you have a wife, you want to have children, that's fine, or a good partner, you want to have children. And then this is time to find out and explore all the options that I mentioned before. Assist reproductive technique, as artificial insemination with donor sperm, or adoption. Like I mentioned before, 15 years now into the development of this particular wonderful technique, more and more young men would prefer to have assist reproductive technology to have biological children. Remember, Dr. Jarvie mentioned the cost can be high, and I have a quote between $12,000 to $18,000. That depends on which fertility clinic you go to. So these are realities. So if you want to plan ahead, you might want to save up some more money before you start doing this, and that's very important. Another most important thing to remember, though, is that the major determinant of success really also rests on the age of your partner. Women older than 35 would have reduced fertility ability. So there have been one study I read that if a woman is older than 40, the success rate can be down to 10%. So if you're going to invest this much money, you might not want to wait too long. That's my point. Again, I really would wish people that when they start coming to have a meeting and have the semen analysis. But I can be honestly to tell you that majority of the people, that's the first time they are ever offered this test. And I hope that these things will change in the future. But anyway, so that had to be done first to confirm your fertility status or infertility status. And again, like the female living with CF, you need to test your partner to make sure carrier testing is done. I remember that it does influence people's decisions. I counsel a couple, and I remember when we were talking about carrier testing, the young lady who's married to a young man with CF was saying that if I turn out to be a carrier, I would rather adopt. And then she further explained that I was adopted. I couldn't find better parents. So in her case, adoption was just a natural thing to do. If it's one of the options that she can do, she would be happy to do it, and she live it, and she know that it can be successful. And oftentimes I will connect it to another couple, and because I had the privilege of knowing all of you very well, or patients very well in my program, and that I know who wants more information and who doesn't need a whole lot of information. Just help me, guide me through it, and that's it. Some people would want to talk to more people about it. Now, I think it's very important, especially in this particular case, when the male has CF, the female is a partner who is sharing this whole venture. And that, you've talked about earlier, remember Dr. Jarvie mentioned about fertility drugs to stimulate, you develop more eggs so that they can retrieve it to let the sperm collected to fertilize the egg. Well, that is going to be some temporary discomfort and emotional upheaval because the fertility drug can affect your moods and your feelings and a little bit of a bloating. It's all going to be temporary. But if you talk to someone about it, then you know that it's not going to last forever. It's easier to tolerate, and they can sort of encourage you and tell you the reality of things. And we can also prepare the young men to bow to her during that period, and that they can get through that period much easier. So you look into the future, men and women with CF, then you have to discuss the possibility of supporting you and caring for a young child should you become ill and have unfortunate early death. I think this is applied to all parents. It doesn't just apply to people living with CF. Personally, I feel that any person who's going to be a parent should consider who can look after your child if you should suddenly get hit by a bus and become seriously ill, or who can support you, or if your partner is able to carry on and be a single parent for a long time or for a while until she finds another supportive partner. So those are the very serious issues that I think it should be openly discussed as a dialogue. And then again, search into your support system and who in your relative system within or friends that would be of great support to you should these things happen. And they can be great support to keep you healthy, to allow you time to do your treatment, and also when you're unwell, they can be support to you, to the child, and to your loved one. And again, everything costs money. So considering having a child is not cheap. So you need to think about what other adjustment you might have to make. Maybe a smaller house so you can work less hours to spend time with the child and buy stuff for the child. Or maybe that's some other decision you have to make to adjust to a new life of living. And the couple inform the CF team about referral. Oftentimes, what do we do? So usually after I finish talking to the couple, I would tell them to go home and talk about it. When you decided to be referred, then let me know, and we will see, who we can refer you to. Now, in my position, it's really easy because I'm in Toronto, and I know a lot of good people in Toronto. And there's certain fertility for men that I sent to all the time, and I'm pretty sure everybody knows who. But there's also other clinic that is very helpful to do the part where the gynecologists and the fertility specialists who work with the couple eventually. But most of the time, people have done their research and they have kind of an idea who they want to go to, although we just sort of give them the facts about who we know. And I base a lot on patient feedbacks. I ask them once they've gone through it, what's good about it, what's not so good about it, what do you like about it. And one person said, this doctor charged me a little bit more to investigate my wife's issue, more detail, and that's, but I'm so glad because he found this and that, and then now we have this very healthy little baby girl. So that's worth it. So I hear these information, but I also respect the individual couple who already select a referral doctor in their mind. So the final referral basically is based on the patient feedback and the couple's preference. So my final words, I think everyone can find reasons not to have children or have children. It's important that the decision must be made by the couple. There's no rules about right or wrong. It is how you feel, how you would love or not love to have a family under certain circumstances. But being a person who's now seasoned and have 2 grown boys and a loving husband for 31 years, I can tell you that really, and learn from my parents as well, I think the best gift any parents can offer to their children really is to love one another. Because I do believe that a child survives through many changes and storms if it was brought up in an environment that's full of love.